This medication we're going to talk about now is furosemide. That's the generic name for Lasix. Lasix is a loop diuretic. It's going to actually work at the loop of Henle down at the nephron or the kidney level to inhibit reabsorption of sodium chloride. We're going to give this to patients in congestive heart failure. We got that pulmonary edema maybe from heart failure. We're going to try to help evacuate some fluid off of this patient. Now, since I'm moving fluid, I got to be real careful. I don't want to give this to people that are already dehydrated or hypovolemic. I also don't want to give it to people that have low potassium level or other electrolyte derangements. Some of the some adverse effects or possible side effects here. Remember, if I'm moving fluid off this body, I got to be aware that I'm keep an eye on hypotension. Don't want that to happen. And again, cardiac monitoring just to make sure I don't have too many of these electrolytes that might show up through that. The dose, adult dose, is 0.5 to 1 milligram per kilogram, IV or IO. Typically, a good rule of thumb is if a patient does not take prescription, if they're not prescribed Lasix, we can start with 40 milligrams. If they already take it, if they're already prescribed it by their doctor, I can give them 80, but I want you to remember that weight-dependent dose, 0.5 to 1 milligrams per kilogram. Again, you're going to start seeing changes in the first 5 or 10 minutes, but you really start to get that fluid moving that I told you about. That diuresis is going to begin within about 15 or 30 minutes.